Hello everyone! Welcome to our amazing and great video presentation about immune disorder. Have you ever heard of this type of disease? I'm sure not many people have heard about this disease. If you know about this disease, you are so incredible. In this video, we will discuss the introduction, signs and symptoms, risk factor, pathophysiology, treatments, complication, drug interaction, and the side effects. Now, let's look at what Sjogren's Syndrome is. Sjogren's Syndrome is pronounced as Sjogren's. It is an autoimmune disease. What does autoimmune disease mean? An autoimmune disease means that when your immune system attacks part of your own body cells and tissues by mistake. Sjogren's syndrome is a fairly frequent condition that affects 0.1 to 1% of the population. It is difficult to estimate the actual prevalence because the symptoms of this ailment, such as dry eyes and mouth, might be caused by a variety of other conditions. In Sjogren's syndrome, it attacks the glands that make tears and saliva, which causes dry eyes and dry mouth. Sjogren's can also affect other parts of the body, including joints, lungs, kidneys, blood vessels, digestive organs, and nerves. Moving on to the next part, which is signs and symptoms. First symptom is dry eyes. This symptom persists because it is related to decreased function of lacrimal glands, which is secreting tears to protect and moisten the eyes. Eyes might feel burned, itchy, or feel gritty as if there is sand in them. Redness of eyes is a common sign and it also becomes sensitive to light and wind. Next is dry mouth. It is related to decreased function of salivary glands. By having this symptom, the mouth might feel like it is full with cotton until it feels difficult to swallow or speak. It also affects taste acuities, difficulty with speaking for long periods which can markedly diminish the overall quality of life. Besides, saliva becomes thicker and opaque, which can lead to increased fungal or bacterial infections and eventually create a severe dental caries leading to loss of all teeth in many patients. Other than that, some people with Sjogren's syndrome also can have prolonged fatigue, swollen salivary glands, which is particularly the set located behind the jaw and in front of the ears, persistent dry cough, skin rashes, dry skin, vaginal dryness, and joint or muscle pain. Moving on to the risk factor of Sjogren's syndrome. It typically occurs in people with one or more known risk factors. There are three common risk factors of Sjogren's syndrome. First is the age. It is usually diagnosed in people aged 40 to 60. Second risk factor is gender, where it is much more common in females than males. Lastly is comorbidity. About half of those with Sjogren's have another autoimmune disease, such as rheumatoid arthritis, lupus, or scleroderma. They have significant overlap with Sjogren's syndrome.
Moving on, I will now talk about the pathophysiology of Sjogren's syndrome, which is what has happened in the human's body that causes this disease. Under normal conditions, when your body is being invaded by bacteria or virus, you will have your own body immune system to protect you. Your body will produce immune cells that are targeted against the bacteria or virus. Immune cells that are produced will then kill the bacteria or virus. However, under abnormal conditions such as Sjogren's syndrome, which is an autoimmune disease, your body's immune cell could not differentiate between your own cell and foreign cell such as bacterial cell. Thus, your body's immune cell will mistakenly attack your own body cell. In the case of Sjogren's syndrome, the human cells that are being mistakenly attacked are specifically cells of the exocrine glands, such as lacrimal glands and salivary glands. Attacking the cells of these two glands reduces production of tears and saliva, leading to dry eyes and dry mouth. The exact mechanism of pathophysiology of Sjogren's syndrome is still unknown, but the cause of this disease is thought to be multifactorial, which involves genetic, hormonal, and environmental factors. First, we are going to talk about the genetic factors. There are genes which are associated with human leukocyte antigen, HLA. Some people have mutations in the gene, causing them to be more susceptible to Sjogren's syndrome. Next, we have the hormonal factors. Estrogen strongly affects the cause of autoimmune disease, as itself is critical for initiation of autoimmunity. Females have higher levels of estrogen in the body, therefore they have higher antibodies levels at baseline and produce more antibodies in response to infection or immunization compared to the males. This difference persists only throughout the female reproductive years, after first becoming apparent during puberty. Lastly is the environmental factors, which are viral infections. When viruses such as HIV, hepatitis C virus, retroviruses, and cytomegalovirus invade the human's body, it will activate your body's immune system to produce immune cells to kill the virus. It will then cause the gland size to increase and lastly leads to dysfunctional glands and secretions.
The treatment for Sjogren's syndrome focuses on treating the symptoms as there is no cure for this syndrome. Firstly, we will start with the pharmacological treatment. For treatment of dry eyes, drugs such as cevimeline, pilocarpine, and cyclosporine can be used to alleviate the condition. Cevimeline can stimulate tear secretion while pilocarpine increases production of tears and cyclosporine can decrease eye inflammation. Next, for dry mouth, the same drug cevimeline and pilocarpine is used as they can stimulate saliva secretion and increase production of saliva. In addition to that, salivary substitutes such as gels and lozenges can improve lubrication of oral tissues. For skin rashes or dry skin, cream moisturizers help to promote moisturizing effect and skin ointment like Vaseline can seal existing moisture into the skin. Another drug named natoximab helps to provide improvement for salivary gland swelling, while vaginal lubricants such as Astroglide helps to relieve vaginal dryness. For joint or muscle pain, swelling, and stiffness, hydroxychloroquine and methotrexate are used. Hydroxychloroquine can treat inflammation of synovial membrane, while methotrexate helps to treat inflammation of muscle. Prednisone, which is the corticosteroid, can alleviate vasculitis by reducing inflammation of blood vessels. And lastly, acetaminophen or non-steroidal anti-inflammatory drugs, NSAIDs, are used to treat pain, swelling, and tenderness of joints. Moving on to the non-pharmacological treatment of Sjogren's syndrome, it is advisable to increase exercise, avoid activities that can cause dryness or dehydration, and stop smoking if necessary. For a person having Sjogren's syndrome, he or she might develop complications such as eyelid inflammation, oral thrush, blurring vision from dry eyes, dental decay due to decrease in saliva production, and yeast infection. Now, I will talk about the drug interaction and side effects of the drug used to treat Sjogren's syndrome. Patients are not advised to take drugs which can interact concomitantly, as this can cause unexpected side effects. For example, pilocarpine, which is used to treat dry eyes and dry mouth, can interact with beta blocker, a hypertensive drug, and reduce the conduction activity at the heart, while concomitant use with atropine will reduce the effectiveness. Another drug, cevimeline, also can interact with beta blocker and causes shortness of breath and wheezing. In addition, it can also interact with antihistamine, which is used for allergic reactions and worsen the side effect of dry mouth. As we enjoy the benefits of using drugs, they can also come with side effects that we need to be aware of. First is cevimeline. It can cause nausea, headache, runny nose, and change in heartbeat and blood pressure. Next, pilocarpine can induce chest pain, diarrhea, shortness of breath, blurred vision, and increased urinary frequency. Cyclosporine may cause infection, seizures, encephalopathy, a brain disorder or damage, increased uric acid level that can induce GOT, anemia, which is a decrease in blood cell, and gastrointestinal disorders. Methotrexate causes acute kidney failure, bone marrow suppression, and gastrointestinal toxicity. Lastly, rituximab can cause cardiovascular reaction, for example, irregular heart rhythm or known as ventricular fibrillation, nausea, vomiting, diarrhea, and abdominal pain.
Looks like we have come to an end to our amazing video. To conclude, Sjogren's syndrome is an autoimmune disease with various clinical manifestations, which are dry eyes, dry mouth, fatigue, and so on. The goal of treatment is focusing more on symptomatic relief. From now, we know that there are pharmacological treatment and non-pharmacological treatment. Cyclosporine, pilocarpine, hydroxychloroquine, and NSAID are the examples of pharmacological treatment to treat the symptoms, which are dry eyes, dry mouth, and others. Pilocarpine is a drug to stimulate tear and salivary gland secretion, and paracetamol can be used to reduce muscle pain. Moreover, non-pharmacological treatment can also be done to relieve the symptoms, which are exercise regularly, stop smoking, and avoid exposure to low humidity environments. Thank you everyone. Thank you for listening attentively.